I'm Dr. Aruna Prasad, consultant dermatologist and cosmetologist, practicing in Pranav and Skin and Cosmetology Clinic, Kalyan, Nagar, Bengaluru. Fungal infection in these areas like underarms, between the thighs and toes. So we call these as intertriginous areas. And this fungal infection we call them as Intertrigo. That's the name we give for the disease. And this is commonly seen because of the sweat which accumulates there, and in the toes because of the repeated washing of the feet and the water remains, or people who sweat a lot and wear shoes for the long term. So the sweat remains, which is like a culture media for the fungus to grow. So we tell them to wear shoes, if they're going to wear shoes for the long term, to slip out of the shoes and then aerate in between with the socks on, or dust a powder. And even same applies for the underarms and between the thighs. These are the closed, dark, moist areas which are prone for fungal infections. Keeping the areas dry and dusting the powder. If the powder gets wet, we tell them to again take a tissue, remove the wet powder and dust a fresh powder again. Not to leave the wet powder, that can even worsen the condition. These patients will need oral antifungals, only topical will not help. And oral antifungals long term, maybe a month, maybe 2 months. And an antifungal cream to be applied in the night and to avoid in the daytime so that they don't feel sticky. And long-term medication is very important. And especially if they're elderly and they're diabetics, all the more they may need long-term medication, and not to miss but to see a doctor immediately.